One of the things that people talk about, because I do a lot of rhinoplasties, I've started doing a lot of rhinoplasties, is that does the natural thickness of a skin have an implication on the result of the rhinoplasty? Of course it has. Of course, it's very obvious that whenever the envelope is thicker, the underlying structure does not become very prominent. So that does not mean, like we used to think in the past, that we should not do rhinoplasty or offer rhinoplasty to people who have thick skin, but rather there are ways to deal with it. So what's the first way? The first way is that we try and thin down the skin preoperatively. I refer them to my dermatologist colleagues who apply vitamin A preparations and thin down the skin. Number two, peroperatively, while we're doing the surgery, what we do is that we make the framework thicker, bigger and harder so that it is visible through the thick envelope. And number three, we try to thin down skin just a little, not a lot. But the thing that needs to be kept in mind is that with thicker skin, the results come a little later than when there is thin skin. Why? Because this thick skin will take some time. The swelling will take a little longer time to settle on the underlying structure. So that's one thing with the thicker skin, but it is not a contraindication for rhinoplasty anymore. Does skin have an impact on the outcome in rhinoplasty? Of course it has, because of course it's an envelope. If it's thicker, the results will be thicker. If it's thinner, the results will be thinner and finer. But there is a downside to the thin skin as well. Why? Because of course the margin for error and margin for asymmetries and irregularities is very minimal. The surgeon has to be extremely immaculate in whatever he does inside, because no amount of hiding in a thinner skin can be hidden, because the thin skin will reveal everything. So there is a higher chance of revision rhinoplasties in thin skin individuals as well, because slight abnormalities, slight asymmetries just become visible over a period of time. So a very careful plan is needed to be made by the surgeon to do that. Can we make it thicker? In a way we can. Sometimes when the skin is too thin, what I do is that I do a session of nano fat injecting into the nose to make skin a little thicker so that I can have better results afterwards. But not always. Sometimes I add this fat peroperatively. During the surgery, I add the fat, and so that the skin becomes thicker over a period of time during recovery. But the swelling goes down faster in thinner skin. The results are beautiful, but the surgeon has to be a master in it. Thank you so much.